Hello, my name is Mary Ellen Quinn. I am a postgraduate DNP student at Brandman University, and this is the Stakeholder Education Plan for my clinical scholarly project. The objectives of this presentation are to present a brief overview of the problem to be addressed and the goal of my clinical project, to identify my key stakeholders and discuss their roles and educational needs with respect to my project. I will present the theoretical foundation for my stakeholder education plan and give the specifics for delivering that plan. Among commercial motor vehicle drivers, the prevalence of obstructive sleep apnea is estimated to be between 17 and 28%, compared to 2 to 4% in the general population. It is also estimated that the risk of motor vehicle accidents is increased twofold to sevenfold by the presence of obstructive sleep apnea. Parks et al., 2009. According to the National Highway Traffic Safety Administration, in 2012, occupants of other vehicles accounted for 73% of all fatalities in crashes involving a large commercial vehicle. Screening for the risk of obstructive sleep apnea in commercial motor vehicle drivers is viewed, therefore, as a public safety concern. The medical examination form for commercial driver exams has only one question related to sleep disorders. In 2006, a joint task force from the American College of Occupational and Environmental Medicine, the American College of Chest Physicians, and the National Sleep Foundation published evidence-based recommendations for the screening and evaluation of obstructive sleep apnea in commercial drivers. As of May 2014, any medical examiner wishing to perform commercial motor vehicle driver examinations must be certified and listed on the National Registry of Certified Medical Examiners. My clinical scholarly project will seek to answer my PICO question. In commercial motor vehicle drivers, does use of an evidence-based screening tool versus standard documentation increase identification of drivers at risk for obstructive sleep apnea in a 2-month period of time? My project will be implemented in 5 urban occupational health clinics that are part of Banner Occupational Health Services. Banner's mission is to make a difference in people's lives through excellent patient care. Banner's vision states, "We will be a national leader recognized for clinical excellence and innovation, preferred for a highly coordinated patient experience, and distinguished by the quality of our people." The mission and value is important to my education plan for stakeholders. Banner specifically notes a desire to be recognized for clinical excellence and innovation. A stakeholder has been defined as any group or individual who can affect or is affected by the implementation of a change project. Pelticorpi et al., 2007. Within my organization, key stakeholders are identified as follows. Banner Occupational Health Service Administration, which includes my clinical chair, Dr. Heidi Rober-Rice, the physicians and advanced practice providers who work in our clinic system, and the clinic staff, both front and back office, who will be involved in helping with the project. The role of administration is to approve the project implementation in the clinics and to provide financial and administrative resources. Equally important is their demonstrated support for the project which can help influence clinic staff. Their educational needs include having a basic understanding of the evidence-based foundation for the joint task force criteria that make up the screening tool to be utilized, how Banner's mission and values align with the project goals, and what resources and time will be involved for the clinics and staff. The physicians and advanced practice providers will be doing the actual commercial medical driver examinations and are responsible for the collection and input of information on the screening tool, as well as the assessment of risk determination. Their role in providing feedback will be invaluable to the project's success. Their educational needs include understanding the purpose of the project. All of our clinic providers have been certified through the Federal Motor Carrier Safety Administration and are listed on the National Registry of Certified Medical Examiners. Part of their educational need will include an understanding the impact this project has on their responsibility as a certified examiner. They also need to understand the evidence-based screening tool itself and how it will be utilized. Clinic staff roles will include registration of drivers and attachment of the screening tool to the DOT examination appointment in the electronic medical records. These tasks will be completed by the front office staff. Back office will obtain vital signs and measurements and document appropriately. Both groups will provide feedback throughout the project. Their educational needs consist of having a basic understanding of the issues concerning obstructive sleep apnea, why it creates a risk for commercial drivers, and the purpose of the project. They need to learn the specific documentation that will be needed and how to utilize the screening tool. The theory of planned behavior provides the foundation for my stakeholder education plan. This is a social psychology theory focusing on behavioral intention to perform a specific behavior. The stronger the intention, the greater the possibility of behavior performance. If a provider or staff perceive there is support and willingness to overcome barriers to change, this then can influence their intention to perform a specific behavior. The strategy for delivering an education plan has to be relevant to each group. Different audiences will be addressed differently, reflecting the importance of knowing your audience. Cotter and Whitehead, 2010. Administration and providers meet quarterly for a joint business education meeting. My stakeholder education plan will be presented at this meeting. An overview of the joint task force criteria for screening will be presented. The project will be introduced as an opportunity for Banner to participate in the validation of the screening criteria. The importance of best practice with respect to our certification as medical examiners will be emphasized. How the project aligns with Banner's mission and values will be presented. Future opportunities, such as participating in development of protocols for our clinics as a result of the project findings, will be presented. At subsequent quarterly meetings, administration and providers will be updated regarding the project's progress, and feedback will be solicited. Lunch and learn sessions will be held for the clinic staff. A basic overview of obstructive sleep apnea, the associated health issues, and the risk for commercial drivers will be presented. The purpose of the scholarly project and the role of clinic staff will be discussed. It's important that the staff don't view this as just additional tasks that are being assigned to them, but realize that they play an active, critical role in the project's success. Specific documentation will be reviewed. Staff will be updated regarding the project's progress at their monthly staff meetings, and feedback will be encouraged. These are the references that were cited throughout my presentation. Thank you for your attention.